Hi, my name is Robb-Lavoie, and for the second video, I'm going to be doing the case study on a patient with decreased range in left neck rotation. Here's my patient. For the first exercise, I'm going to be using my manual technique. In this case, I'm going to get my patient to lie on her stomach facing me, and with her head in her hand so she can tuck her chin in a little bit. Just going to move hair to the side. So the movement I'm going to be doing is a unilateral PA of the transverse processes on the right side of the neck. I'm doing it on the right side because when the neck turns to the left, the right TPs go down. So if I'm pushing on the TPs, I'm helping the movement, which is usually done with a left neck rotation. And I'm going to hopefully gain a range of motion that way. So to find the TPs, I'm going to find the corner of the jaw and the occipital, the occiput here, and right in between I can find the TPs of C1. So I'm going to be using her right side. So I'm going to check on, I'm going to go down the whole cervical spine from C1 to C7. 3, 4, 5, 6, 7. And I'm going to, for that I was just checking where there is decreased rotation in the vertebrae. So I can find which vertebrae I need to work on most. So let's say I need to work on C3 here. I'm going to be doing a grade 3 Maitland mobilization. And I'm going to be doing 20 oscillations on this right side. So for grade 3, what I do is I push to the first barrier and to the second barrier. And it's just oscillations between the first and second barrier. 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. Good. So after that, we've hopefully gained some range of motion, and I'm going to get you to turn onto your back. I'm going to move into my range of motion exercise. For the range of motion exercise, move the pillow out. There you go. So for this range of motion exercise, I chose a supine neck rotation. So all I'm going to ask you to do is lie down and turn your head to the side. So 10 times per side. I like this exercise because it's a good exercise to start because it's gravity lessened. And at the end of the range of motion, gravity is actually helping the patient move into a further range of motion. Okay, 10 per side. So next, I'm going to get you to come and sit on the edge of the bed, please. I'm going to move into my strengthening exercise. So for this exercise, I'm going to do an isometric seated left neck rotation. So what I'm going to do is you're rotating to the left, so I'm going to get you to take your right hand and put it on your left temple. I'm using the right hand because I don't want her, when using her left hand, to activate any muscles here. I want it to stay nice and relaxed. And I'm getting her to put her hand on her temple instead of anywhere else in her face, like her TMJ, because if she puts pressure on her TMJ, this could create problems in the future. So I'm going to get you to press against your hand for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And you're pressing in rotation. Yeah, that's the exercise. This exercise can help with strengthening the rotation of the neck, and if the missing rotation is from a lack of strength, we'll start with this exercise and build the strength further. And the last exercise, staying in this seated position, is a stretch of the right anterior scalenes. We're working the right scalenes because the scalenes do side bending and rotation to the opposite side. So in this case, left rotation. So I'm going to get you to do is you're working your right scalenes. So you're going to turn you're going to bend your head to the left and look to the right. So this is the opposite of what the right scalenes do, and you're just going to press your hand over your head to get a good stretch out of it. So we're going to do 2 times 30 seconds of this stretch, and this stretch is to relax everything after the small treatment and to further increase the range of motion and decrease some pain. And that's it. Thank you.